Tonight, growing concern about monkeypox. The World Health Organization has declared a global health emergency. Now the White House is weighing whether or not to declare a public health emergency here in the United States. Cases have skyrocketed from 1,400 less than 2 weeks ago to nearly 3,000 right now. The vast majority of cases are among men in the LGBTQ community, but 2 of the latest cases are in children. While the rarely fatal virus is not new, the CDC says the rapid spread is.
We're coming out of COVID, right? It's been 2 years of people not traveling, not attending parties, not having fun. And I think there's some amplification of this that's happened as a result of people going out, living their lives.
Monkeypox leads to painful lesions and sores. It normally is spread through close physical contact, but it can also be spread through respiratory droplets and shared clothing, towels, or blankets. In Missouri, there are 5 reported cases. In Illinois, 238. There are 2 probable cases in our area, one in St. Louis City and another in St. Clair County. We know you have a lot of questions about the spread of monkeypox here in the St. Louis area. Tonight, we took those concerns to a Washington University Infectious Disease Physician at Barnes-Jewish Hospital. Pepper Baker joins us now with what you need to know. Pepper?
And major cities like New York are seeing thousands of monkeypox cases. The St. Louis area has a low threat, but physicians predict it will spread. We are kind of in a learning as we go situation with this virus, but good news, there is testing and vaccines available.
This isn't something to freak out about and panic about, but this is something to be aware of.
Washington University Infectious Disease Physician with Barnes-Jewish Hospital, Joseph Cherabie, says there are 3 confirmed monkeypox cases in the St. Louis region.
And we're expecting increased spread in the coming days and weeks.
Cherabie described monkeypox as being a cousin to smallpox. Prior to the 1980s, the smallpox vaccine was regularly administered.
Luckily for us, the vaccine against smallpox works against monkeypox. And so we do have a vaccine.
There are 2 different formulations of the smallpox vaccine. The newer one, known as the Genios vaccine, is more widely used.
You don't have the risk of the same side effects as the other vaccine. It is much easier to give, and it involves giving 2 shots 4 weeks apart from one another.
In theory, Dr. Cherabie says if you were previously vaccinated for smallpox, you should have some protection against monkeypox.
That having been said, if you have been previously vaccinated against smallpox and you do have an exposure to monkeypox, we do recommend getting a post-exposure vaccination with the newer formulation of the vaccine.
Monkeypox symptoms include flu, fever, and what's most commonly seen are the blister-like lesions. 95% of the cases are amongst men involved with same-sex practices.
We need to prioritize gay and bisexual men who have sex with men right now, but also be aware that it can spread to other individuals as well.
The virus spreads from exposure to the lesions. A person is still considered infectious until their lesions have burst, crusted over, and completely healed.
We have the ability to get vaccine, and in order to provide vaccine for all individuals who are a direct exposure. But that is, with the limited supply that we have right now, that is the only population that we can currently give vaccine to.
Now, monkeypox testing is available. You can go to your primary care physician, urgent care, or the county and city health departments.